By the end of this module, you will identify and explain common chronic illnesses affecting elderly populations, understand pathophysiology and symptoms of major age-related diseases, recognize complications arising from comorbid conditions and polypharmacy, develop holistic and interdisciplinary care strategies, advocate preventive interventions to reduce hospitalizations and disability. Chronic diseases are the leading cause of morbidity and mortality among the elderly population. As individuals age, the cumulative effects of genetic predisposition, lifestyle, environmental exposures, and health inequalities contribute to the onset of long-term, progressive health conditions. This module provides a robust, comprehensive, and detailed exploration of the most prevalent chronic illnesses affecting older adults, their underlying pathophysiology, symptoms, complications, prevention, and multidisciplinary care approaches. We also examine the impact of comorbidities, polypharmacy, functional decline, and how to develop sustainable care plans that support autonomy, reduce hospital admissions, and improve quality of life. This module is grounded in WHO's Integrated Care for Older People, ICOPE, NICE guidelines, and CPD-accredited care standards, ensuring you are equipped for evidence-based elderly health management. Definition and classification of chronic illnesses. Chronic illness is defined as a health condition lasting 3 months or longer, requiring ongoing management and potentially progressive in nature. Primary classifications include degenerative diseases, autoimmune conditions, metabolic disorders, cardiovascular diseases, neurocognitive disorders, cardiovascular conditions, hypertension, high blood pressure, often asymptomatic, silent killer, risk factor for stroke, kidney failure, heart failure, requires lifelong medication and lifestyle adjustments, coronary artery disease, CAD, narrowing of arteries due to atherosclerosis, can lead to angina, myocardial infarction, monitoring through ECG, lipid profiles, stress tests, heart failure, inefficient pumping of blood leading to fluid retention, symptoms, fatigue, breathlessness, edema, use of ACE inhibitors, beta blockers, diuretics, metabolic disorders, type 2 diabetes mellitus, insulin resistance or deficiency, polyuria, polydipsia, fatigue, slow wound healing, managed with diet, exercise, oral hypoglycemics, insulin, hyperlipidemia, high cholesterol triglycerides, cardiovascular risk, requires dietary changes and statin therapy. Obesity in older adults can exacerbate arthritis, diabetes, hypertension, promotes metabolic syndrome, neurodegenerative and cognitive disorders, Alzheimer's disease, progressive memory loss, disorientation, language issues, no cure, managed with cholinesterase inhibitors, support, Parkinson's disease, motor symptoms, tremor, rigidity, bradykinesia, non-motor, depression, sleep disturbances, treated with levodopa, physical therapy, dementia, broad term for cognitive decline, importance of early diagnosis, MMSE, GPCOG tests, musculoskeletal and skeletal illnesses, osteoarthritis, OA, degeneration of cartilage, common in knees, hips, spine, symptoms, pain, stiffness, reduced mobility, treated with NSAIDs, physical therapy, joint replacement, osteoporosis, decreased bone density, increased fracture risk, diagnosed with DEXA scan, treated with bisphosphonates, calcium, vitamin D, rheumatoid arthritis. Autoimmune, affects joints symmetrically, more inflammation than OA, immunosuppressants, steroids, chronic pulmonary conditions, chronic obstructive pulmonary disease, COPD. Includes emphysema and chronic bronchitis, persistent cough, dyspnea, wheezing, inhalers, oxygen therapy, pulmonary rehab, asthma in elderly, often underdiagnosed, triggers, cold air, allergens, medications, kidney and liver disorders, chronic kidney disease, CKD, reduced glomerular filtration rate, GFR, symptoms, fatigue, nausea, edema, confusion, complications, anemia, acidosis, electrolyte imbalance, liver cirrhosis, often from alcohol use, hepatitis, ascites, jaundice, variceal bleeding, liver function monitoring essential, cancer in the elderly, increased incidence due to aging cells and reduced immune surveillance, common types, prostate, breast, colorectal, lung, importance of early detection, screening programs, psychosocial support and palliative care, comorbidities and multimorbidity management, complex interactions between diseases, polypharmacy risks, drug-drug interactions, adverse effects, role of interdisciplinary teams, holistic care planning using frailty index, comorbidity scales, preventative and proactive care approaches, regular screenings, BP, blood sugar, cholesterol, cancer, lifestyle modifications, smoking cessation, weight loss, mobility aids, nutritional counseling, exercise programs tailored to chronic conditions,